For my presentation, I'm going to be exploring the impacts of mental health support within a college, analysing internal policies and wider issues regarding access to mental health services and what those impacts may be. For my primary research, I asked 25 of my students what was their experiences and what issues were they faced when trying to access mental health support. Location was a massive one, as a lot of my students live quite rural, and even the ones that live rather in a city, trying to find free access was rather difficult, as a lot of these facilities did not have easy bus routes to get to, or they weren't in walking distance, or the taxi fare was too high, so therefore the accessibility of the location was a huge issue. They found that even the lack of funding for quality services set out by the government and local governments was apparent. They, as young adults, had realised that, not having access to facilities due to location is most likely going to be of this issue with funding into mental health services for young people and children. Additionally, with access, that there just wasn't enough services available, and the ones that were available, as said previous, were either too difficult to get to and too far reach, and therefore there just isn't an accessible amount of services for them to reach. For a lot of my SEND students, they specifically told me that the help that they did get from seeking support wasn't specific enough, and that they felt the advice was too vague and just was not suitable or specific enough for their specific needs and wants. And finally, waiting times, waiting lists being too long for services, or that they didn't bother trying to access support due to how long the waiting times were, and for some instances when they just wanted very low level support when it came to stress for exams, that by the time they got an appointment it wasn't relevant to their issue anymore. Additionally, with access, that there just wasn't enough services available, and the ones that were available, as said previous, were either too difficult to get to and too far reach, and therefore there just isn't an accessible amount of services for them to reach. To critically look at the issues facing students when it came to support systems, is that with a lot of them, poor quality of care, that mental health services may not have been practical, or the quality of care provided may not have met the needs of the children. This being part of the secondary research where misdiagnoses have occurred and appropriate interventions have not been specific or have not been tailored to that child's needs. And with a lot of the children's mental health that we are seeing within the college, that they may actually be connected to their environment. With one specific incident where a student had been homeschooled due to bullying and now coming back into a schooling environment, the environment itself is what is causing those underlying problems with their mental health. Alongside many students being either misdiagnosed or issues not being properly assessed due to a poor quality of care and specific enough with their needs, they found that a lot of the treatment plans that were given to them resulted in a resistance to treatment because they were either too vague or too general, or that they were too tailored to well-being rather than that of some serious addressing of mental health issues. With one instance where an autistic student had been discharged from CALMS, and with CALMS telling them how to change their diet in order to help their mental health, where that wasn't the issue. And with due to a lack of access, when students have been able to access mental health support, some of the services have proven to not be practical to tailor to their needs, whether that be the quality of care or the fact that students have built up a resistance to treatment due to negative experiences in the past. This has a significant impact on stakeholders, parents and carers being worried about the quality of care of their child within the college. However, when the is a positive impact of services. We have found that parents become confident that their child is looked after. The college is happy when it comes to obtaining and continuously maintaining not only attendance, but also that students are progressing, and that is reflected within their work, which is then reflected on the college and staff itself. Students' voices is felt listened to, which is so significantly important when it comes to not only their own self-esteem and well-being, but it is also when we are getting feedback is how we can improve access to support services and how us as classroom teachers can provide pastoral access for students who may just need someone to talk to. It is giving us that impact of like, what is it we can do better and what is it that is not working. In terms of policy, NCG have a very strict health and safety and well-being policy. All colleagues must follow these health and safety regulations, not only for our own physical health, but that of people around us. This is including staff, additional members of staff, as well as obviously students and ourselves. We all have a safeguarding team on every floor within the building, whether we need to access them or not, and all students will know who their safeguarding officer is, whether they'll speak to me and then I will pass that on to safeguarding officers, or whether they go directly to them. Lanyards must be worn in the buildings at all times. If students were to forget theirs, they have to have a specific ID badge to then wear for the rest of the days. We have to make sure that visitors are safe within the building and that they themselves are wearing the appropriate lanyard. And if there was ever an issue where we did not feel safe with people within the building, we have to tell our safeguarding officers. We also are up to date every year with our safeguarding policies, and we must be kept up to date with our safeguarding training. NCG promotes us to report irresponsible behaviour, especially when that comes to either hazardous materials, unsafe equipment, or any sort of practices where incidences may appear. We have to be very, very assured that there is no misuse or interference with any of the equipment that we work with, whether that's within our own department or other departments when it comes to even cover work. We have to make sure that all of our equipment is also maintained and in the correct manner. For instances within my sector in the fine art room, making sure that all equipment is in the appropriate places. There is any electrical equipment near the sinks. Sewing machines are turned off at all times. If there is not an appropriate member of staff within that part of the building, in order to ensure that it is working safely for any foreseeable emergency that may arise due to ill treatment or ill use of any of the facilities provided. So when it comes to internal support through the college, we have what is known as Target's team and a mental health hub. I will be specifically talking about Target's team as they are the ones that we work very close by as classroom teachers. So what Target's team is that is an accessible team through the college's website, and what they do is to work and tailor towards aiding SEND students and providing steps for diagnoses for specific learning difficulties or other specific educational needs or disabilities. What Target's team also does for those who may not have any SEND or specific learning difficulty issues is to provide a personalised plan for students who may just be struggling, whether that's short-term or long-term, with any sort of mental or well-being issues. For instances, Target team may give you a personalised plan. If you are struggling with organisation or stress, they will give you pointers and strategies and milestones in order to help students maintain healthy, good habits to promote not only their own well-being, but also that quality within keeping up to their standards of working within the college. So for an example, we have a student who has autism, and one of their issues is feeling quite overwhelmed in the classroom, and we with Target's team have provided her leave of the classroom if she is to feel overwhelmed, so she can de-stress and come back into the room feeling, rejuvenated and feeling a lot safer and a lot more calm in order to get on with her work. So we can basically damage control any issues that may arise if a student does not feel as if those issues are being tailored to or listened to. It is their own personalised plan in order to benefit not only us as classroom teachers, but themselves as young individuals. To conclude, Target's team is an accessible way for students to receive support for mental and well-being aid within the college itself. Although students did find that their needs in support may not have been specific enough for what is available internally, and due to wider factors such as funding and accessibility, finding any sort of external mental health support may not be available for students. And the quality assurance given by the college in terms of safeguard and well-being is upheld to an incredibly high standard and is updated yearly. So our students, as well as staff and ourselves, are under the assurance that we are kept safe, and those safeguard policies are also then upheld by law if something was to significantly happen regarding safety. And as classroom teachers, there's only so much we can do on our end before Target's team and other legislation externally and internally takes into account. But it is within our duty of care to our students. And we do this through differentiation in classroom activities to make sure that SEND students and all students are accommodated for, but it's also within our pastoral duties to make sure that our students feel safe and feel as a sense of belonging within our classrooms.